Okay, so let's talk about mindset first on what you should be focused on, and then we'll talk a little bit about body, if you have some of that brain fog or low energy. So first things first, the mindset. Most students have the wrong focus. Guys, you shouldn't be focused on the results. Basically, you shouldn't be focused on passing. You should be focused on prepping. Every single morning, you should be focused on asking yourself, how can I get better today? How can I absorb, that content better? Or how can I take these questions better and approach it better? I see students all the time focused on, I need a pass, I need a pass. My parents are looking at me. My friends are all passing. I need a pass. My job's waiting for it. If I don't pass, and they built up all this imaginary stress that basically, they're focused so much on this, number of passing that they don't even focus on studying and they don't even focus on prepping. So, first things first, if you focus on prepping and being the best you can be every single day and really dedicating time, then you will pass. So, don't focus on passing, focus on the prepping. So, I have some notes here. Once again, you will not pass the NCLEX by worrying or becoming an anxious wreck. All you guys control is the preparation. That's the only thing inside of your control. You have no control if you pass or not. You can only control how you prepare for those results. No control in the results themselves. So every time you focus on something, or there's a saying, where your focus goes, your energy flows. So if you focus on the problems of, oh, my parents want me to pass, or my friends are passing, you get that envy, right? Or the jobs require me to pass. And if you're focusing on all these stressors, you're going to be more stressed. So don't focus on that. Guys, if you're problem focused, then you will have more problems. If you're solution focused, then you'll have more energy to find solutions. So never approach your study days in terms of work. Never call it work. Never say, I have to do this. Always say, I get to do this, and I'm grateful to do this because I'm learning how to pass the NCLEX. Try to be curious. Never call work work. Never call study sessions. I call all my work sessions curious sessions. Because usually, if you start everything with curiosity of how can I do something, then it makes everything a lot easier. Because being curious about a hobby or a topic or scrolling through Instagram or just nerding out on Google, no one pays you or forces you to do those things. So try to approach it the same way in terms of gamification. Try to be more curious about this work. Now, one last thing is the negative self-talk. So I see this so often with people who fail the NCLEX 2 or 3 times. If you fail the NCLEX, I believe your 3rd time, they say you have 95% chance at failing again. And the reason is because of your negative mindset. And the NCLEX kind of gets in your brain. And you have all this negative self-talk of all your friends passed and your family's looking down on you for spending 2 years in nursing school and you can't even pass a dang NCLEX, right? This is exactly what happened to our 17-time failure. Her name is Jasmine. I really wanted to do a podcast with her. I really wanted to kind of do a video with her, but she's kind of shy and didn't want to do it, but I'm going to keep that in the works. But this is exactly what her problem was. We talked a bunch over a year and a half to kind of work through this. And once she kind of mastered, her focus into being solution focused and being, cutting the negative self-talk out of her life. Because, man, she was building herself into a negative vortex, kind of like a death spiral, and becoming overwhelmed and even exhausted before she even started studying. So always try to get yourself on the best foot possible. Once Jasmine started that, and I showed her some hacks of how to do it, then we kind of built like this groove or conduit, if you will, and then built momentum off that, and she was able to pass. So if you're in this negative self-talk spiral and you don't know how to stop all this complaining and blaming and being ungrateful, Little side note. There's 3 ways to fail at anything you do in life, and they use the acronym BUCK. So B is blaming others for your problems, being ungrateful, and complaining about everything. So if you find yourself, and if you do like a self-survey, if like, am I a negative person? If you find yourself complaining a lot about things and, blaming others and being ungrateful, then you're probably in a negative self-talk loop. So if you find yourself in this way, the best way to kind of cut, that cycle out of negativity is write this down. There's a trick I use called the 3x3 note card. And it really helped me a few years ago when I myself was in a negative self-talk loop. So the 3x3 goes like this. You have like a 3x5 note card, and you write down 3 things that you're thankful for. So, and try to be as specific as you can in terms of your life right there. So let's say it's just health. Let's say it's family, and let's say it's, your boyfriend or significant other. Maybe it's your dog or your cat. Every single morning when you wake up, the first thing you do to focus, basically they say that the first hour or even the very first thing that you do in the morning will determine the rest of your day. They call it the bookends. The first thing you do and the last thing you do at night. So the first thing you do in the morning, grab this note card right by your bedside and look at your 3 things you're thankful for 3 minutes in silence. Every morning, the first thing you do, no bathroom, no teeth, no phone, no nothing. So it's always how you start your day that will domino into how your day will be. So if you focus on your problems, then that negative energy and your negative flow will basically be problem focused. I see it all the time. I used to do it. I grab my phone and I look at all the problems and all the work that I have to do, right? And I use that term work. But now when you focus on the three things that you're thankful for, you're going to start being more, have more gratitude, more thankful, and easily have a domino effect of positivity. Because at the end of the day, guys, the biggest thing is that everyone watching this video, we all live a pretty decent life. And in order to, be a nurse that's going to inspire others and see other people on the worst days of their lives, you should be a positive person. So if you're watching this video right now and that's the only thing you took away, maybe that's the best thing you're basically going to take away from this entire NCLEX experience, is just being a better person, being a better way to focus. And I can tell you so much that when you're in a negative spiral loop, I've experienced it so bad that you can't see to the left or right, and everything just feels like doomsday. And all you really need is just like this 3x3. You'll start seeing the effects after the first week, and then things magically, at least for me, and I've seen it done in my personal family as well as a few friends, it just does magic. So where your focus goes, your energy will flow. Okay, one last thing is consistency. So I know we touched on this a little bit, but get the mindset of, 6 to 8 weeks, you're going to go through the fire, you're going to hit your numbers, but the consistency, you have to show up. I know like some football coaches and basketball coaches will say, 50% or 90% of the work is showing up. So that's the consistency to momentum and to being a successful person, is just showing up. So it's just like exercise equipment. You're excited to buy it. You buy a bunch of exercise equipment, or you buy a bunch of diet programs. You get Shaun T's ab workout, but 2 to 3 weeks down the line, you fall off the routine. So in the same way, do your best to show up, be consistent, and trust me, if you get those numbers, you're going to pass the NCLEX. The hard part is just getting to those numbers, finding the routine, staying focused on the things that are helping you pass, and don't even worry about all these other stressors that are trying to distract you. Okay, the last thing I want to talk about is the body. So if you're telling me, Mike, I have a great mindset, I am a pretty positive person, I did pretty good in nursing school, and my numbers are pretty good, but I just can't focus. I have a lot of brain fog, or my mental clarity is not there, or just my energy levels. I need a nap every single day, or 2 or 3 naps a day, or I'm just like can't get up and stay focused. I see it all the time. So for brain fog, for mental clarity, write this down. They say that your gut is your second brain. Now, before nursing, I was a personal trainer, and I was going to go into nutrition for the hospital. But that's a whole side story, because nutrition in the hospital, I don't believe really is like real nutrition. It's not really holistic, and it doesn't really heal anyone. But I subscribe to the idea, and it's worked for me, so I'm not telling you anything that I don't do. This is actually my routine. Your gut is your second brain. They say that 80% of the serotonin that your body produces is actually made in the gut, as well as the majority of your immune system is made in your gut. So I don't know if you've ever heard of that before. I know medical studies or nursing school won't tell you that. But this is the reason why if you have diarrhea, that your immunity is shot. And when someone says, oh, I have a gut feeling about that, it's because the majority of your neurotransmitters, at least the building blocks, are stored in the gut. So the first thing I do, I'm going to break this down to 3 or 4 steps here. First things you do is sleep is number 1. Now, if you have really bad brain fog, or if you want to get really focused, I recommend going to bed at 9 p.m. before big study days. Let's say you have, 3 huge study days. You really want to do let's say an 8-hour day or a 7-hour day or a 10-hour day. I knew this one nurse practitioner student. He did 12-hour study days. I was like, what? It's crazy. But anyways, try to go to bed before 9 p.m. or right around 9 p.m. And trust me, it took me I was a midnighter, dude. I was like, I'm such a night owl. I used to work night shift, and I can go up to 2 a.m., and that can be normal for me. But when you go to bed before 9 p.m., trust me, rest and sleep is probably the number one thing in terms of your health. If you go on 3 or 4 days of lack of sleep, and I've seen it done a lot of times in the medical field, you actually get signs and symptoms of mental health issues like depression and anxiety. So the first building block, try to get to bed around 9 p.m., 9:30-ish. If you have some trouble with sleeping, you can always do 5-HTP, melatonin, which there's conflicting studies with melatonin, but you'll get better at it. So they say that every hour you get before midnight, you actually doubles in terms of REM sleep. At least that's what Dr. Oz says. Okay, now we have sleep covered, right? Number 2 is the ketosis. Now, you guys have probably heard about the keto diet and how it could be good for you, how it could be bad for you. But one of the interesting things about being in ketosis, and you're probably even thinking, I never heard about ketosis, that DKA, diabetic ketoacidosis? No. So ketosis brings a lot of mental clarity. It basically means when your body is not burning sugar as fuel, but it's burning more fat as fuel. And it's basically from a high protein diet, almost no carbs. The only reason I say this is because I've experienced so much mental clarity, so much energy. It's kind of like, flipping the switch on resetting all your hormones. It really feels like you're an adolescent again. After the first, I believe it was 5 days. It was the first week for sure, of doing kind of this high protein, very low carb, only high fiber carbs. Man, your brain will start to switch over. But really the big kicker here is skipping breakfast. So the intermittent fasting thing helps you get into this ketosis state. So what I personally do is I only eat between 12 and 8 p.m. And what it does is it basically, intermittent fasting, it shrinks your stomach. It helps you, it's pretty easy because you don't really focus on breakfast. But it really helps you kind of accelerate and get into that ketosis state. Now, like last year, I was doing 3 day fasts every month, every other month, something like that. And man, I can get into mitochondrial genocide and basically how, you're killing off 30% of the cells that should cause disease. There's a lot of studies by Dr. Rhonda Patrick. She was featured on Joe Rogan that talks about, she's a PhD that only does study on basically metabolism. And her big thing is doing, I think it was 3 fasts for 72 hours. So 72-hour fast 3 times a year. But again, that's like a whole nother side conversation. Long story short, like that, like really decreases your chance of cancer. But it's really interesting. But what I do is the intermittent fasting. It helps you get into ketosis faster, and it also gives you that brain clarity once you're inside that range with that low sugar content, and you're really burning those fats for fuel. It's really amazing. Okay, here's the big one here. Number 3, if you have your sleep, and if you're doing this intermittent fasting and just kind of high protein, that low sugary, like low bad carbs, those white flours and sugars, and you're doing that intermittent fasting, high protein stuff, then number 3 works wonders. So in the morning, you should be doing a tablespoon. If you can't do a tablespoon, I would recommend a half tablespoon of MCT oil. Now, a lot of people, they'll say, oh yeah, this is bulletproof coffee. That thing is nuts. Personally, I don't like the bulletproof coffee because you have to add butter and creams. I just add the MCT oil to black coffee, and you can do whatever kind of coffee you want, or you can put it in water or tea or whatever. But trust me, you can even just take it straight up. I think you can. Maybe it gives you diarrhea. No, I think if you take more than a tablespoon, it'll give you like, it basically like really, what it is it's oil that kind of acts like a fish oil. It's not a fish oil, but it kind of acts like that. In a sense that it basically lubes up your brain, kind of like lubing up a car engine to make all the cylinders fire faster. At least that's how I feel. Because man, it's like, boom, it like lights up my brain, and it really helps me get a lot of stuff done and be way more efficient. Now, the 4th thing that I'd recommend is 8 ounces of kombucha as well as probiotics before 12 noon, before your first meal. So the reason for this is, like I said, the gut is your second brain. And I really stress that because the main way to really get this microbiome inside your gut to be kind of humming is by getting kombucha, which is good pro and prebiotics that helps set that normal flora inside of your gut and just creates like a really good environment for everything to function better, especially your immune system and especially a lot of your serotonin and dopamine inside your gut. The cool part about this is that once you do it for the first week, I didn't see results until about the 2nd week, but I've been doing this for a while now. I'll do it like ebb and flows because I like to travel a lot, so a lot of the probiotics and kombucha is not available. But when I come back, I can see a lot of the mental clarity clear up. Now, real quick, if you guys don't have kombucha, or maybe you do, I'd recommend getting the Trilology one, or if you go to Trader Joe's, they have a lot at Whole Foods. If you're not in either, I believe your local grocery store should have some. But if you're going to take the probiotic as a pill form, I'd recommend both, to be honest. But the probiotic for pill form should be taken at night before you go to bed. And I'd recommend starting only, I think it was less than 10 billion microorganisms. I think so. Ask the person that works there. Because I think if you start off at anything higher than 10, then you'll get massive diarrhea and stomach cramps. Because you're just, you're giving yourself such a big loading dose that you need to give yourself time to get up to this range.